Hi guys, so today we're going to talk about vaginal ultrasounds. Your doctor might have you do a vaginal ultrasound if you've been having pelvic pain, if there's some sort of suspicion that you might have a cyst or you might have a tumor in your uterus like a fibroid, or if you're having irregular bleeding, if you're having anything abnormal that there's concern that there might be something in your ovaries or your uterus, so your doctor probably wants to see that everything is normal in there. This is what a vaginal ultrasound looks like. So it's pretty self-explanatory. It's a vaginal probe. This is exactly what it looks like. To cover it, we use either a condom like I have here, and we have a little bit of gel on the tip. In other offices, we also use, we call them probe covers. So this is a vaginal probe. So it's a probe cover, and it looks just like a condom, except it doesn't come with a lubricant. So we put in a little bit of gel inside, and then we put a little bit of gel outside on the top side so that we can see something on the screen. Here we have a bed controlled with an external control. This is what we use to adjust the table for the height, to lower or to raise the feet. The bottom feet can be raised or lowered as needed. And then of course we have, you know, the GYN stirrups that every OBGYN bed has. So we pull out the stirrups, and we might raise your back, or we might lower your back depending on what how we're trying to position you. Once we've adjusted the bed, we use the vaginal probe to insert the probe vaginally, so it'll go in the vagina so we can see something on the screen. So the goal of the vaginal ultrasound is to be able to identify your ovaries, make sure that there's no cysts or that they're not abnormally large, and to visualize your cervix and your uterus. Same thing, make sure there's no cysts in your cervix. I mean, although cysts in the cervix are not that bad. To make sure that you don't have any tumors or anything that might be causing abnormal bleeding, abnormal pain, or any problems. Usually this type of ultrasound, the vaginal ultrasound, a lot of times your doctor will want you to do an abdominal ultrasound as well. So the abdominal probe looks like this. This one obviously, I mean, doesn't go inside anywhere, so we just hold it like this and we do it over the abdomen. Again, we put a little bit gel on there. Sometimes there are some gels that are warm, so some gels will have a warmer so the gel isn't too cold when we apply it. But basically, all together, this ultrasound will take like 20 to 30 minutes. If you're having an abdominal ultrasound, they're gonna want you to fill your bladder, so they'll make you drink a lot of water first so that your bladder is full of water and we can differentiate it from the uterus. So that it's easy to see the uterus, we have you fill your bladder. Then you go pee or empty your bladder, and then we do the vaginal portion of the exam. It's not painful, might be a little bit uncomfortable, especially if you're not used to having pelvic exams. If maybe you're younger and this is like the first time you have a pelvic exam or a vaginal exam, it might feel a little weird or uncomfortable, but it's not painful. I hope this clarifies some answers. Like the video if you liked it, subscribe to the channel, leave some comments, email me at gynogal@gmail.com. Thanks. Basically, the pap smear is a screening test for cervical cancer, and you shouldn't be having this test done unless you're 21 years of age or older. If you're younger than 21, don't let anyone do a pap smear on you because it's not time yet. You don't start to test for cervical cancer.